Hi friends, welcome to my channel. I'll be sharing short and easy notes on gastroenterology. These videos are especially designed to help medical students and healthcare aspirants who are looking for basic medical knowledge. It's also useful for those preparing for various exams, quick revisions, and last-minute reviews. Let's start with presenting problems in gastrointestinal disease. These are the most important signs or symptoms seen in GI diseases. First one is dysphagia, dyspepsia, heartburn and regurgitation, vomiting, gastrointestinal bleeding, diarrhea, malabsorption, weight loss, constipation, and abdominal pain. We'll discuss one by one. The first one is dysphagia. From the word itself, we can understand the condition. Dys refers to difficulty or discomfort, and the phagia, it denotes to eat or swallow. So, it's resulting the medical term for difficulty swallowing. Difficulty in swallowing coexists with the heartburn and vomiting is called dysphagia, but should be distinguished from both global sensation and odynophagia. Global sensation means some anxious people feel a lump in the throat without organic cause. It's global sensation. And the odynophagia means pain during swallowing, usually from gastroesophageal reflux or candidiasis. Next, coming to the next topic, cause of dysphagia is because of oropharynx or esophagus problems. Already we know swallowing begins as a voluntary process that we know already. The food bolus is forcefully propelled by the tongue into the pharynx. The esophagus sphincter relaxes. With the help of peristaltic activity, the food bolus goes down. The lower esophagus sphincter relaxes, the food enters into the stomach. This is the normal process of food entering into the stomach. Is there any abnormalities in the path or any obstruction or any problem in the path? It prevents the passage of food into the stomach. I think you got it. Here, the patient complains of difficulty in swallowing. Next, choking means foreign body air obstruction is choking. Next, nasal regurgitation means when food or liquid travels backward from the throat into the nasal passages during or after swallowing is nasal regurgitation. Next, tracheal aspiration means either the involuntary entry of foreign materials like food, liquid, saliva, objects into trachea, which can cause blockages or infections like pneumonia. That is tracheal aspiration. Next, drooling. Meaning of drooling is flow of saliva outside the mouth. Next one is dysarthria. It's a mode of speech disorder caused by weakness in muscle used for the speech. The speech will be quiet, strained, slurred, like that. Next is hoarseness. The abnormal voice quality, like weak, breathy, scratchy, husky, low pitch, is hoarseness. And the cranial nerve issues and neurological signs are seen. Dysphagia can be categorized based on the location where the swallowing difficulty occurs. There are two types, oropharyngeal dysphagia and esophageal dysphagia. Let's go through them one by one. First one is oropharyngeal dysphagia. Here, the problem with initiation of swallowing may lead to aspiration of the food into lungs. The etiology, any condition that impact the muscle or nerve that help to swallow can cause dysphagia. Diseases like stroke, Parkinson's disease, myasthenia gravis, prolonged intubation, center diverticula. We know stroke and Parkinson's disease. I will explain myasthenia gravis. It is a condition that happens when communication between nerves and muscle breaks down. This causes muscle to feel weak and get tired quickly. Usually it affects muscles of eye, throat, face, neck, arms and legs. Next is prolonged intubation, refers to mechanical ventilation through an endotracheal tube for more than 7 days. Impaired swallowing and speech is the complication of prolonged intubation. Next is center diverticula. It is also known as pharyngoesophageal diverticulum. Diverticula means a small pouch. So, a small pouch that forms and collects the food particles in the throat, often just above the esophagus, leads to difficulty in swallowing. Gurgling sound, bad breath, and repeated throat clearing or coughing are the associated symptoms. And coming to the investigation, the barium swallow test is indicated. Here, in oropharyngeal dysphagia, usually more of the problem with liquid than the solid. But in the esophageal dysphagia, it's opposite to that. Coming to esophageal dysphagia, here the food sticking after swallowing with or without regurgitation can be caused by obstruction or motility disorders. The obstruction can be because of strictures, webs, carcinoma. Stricture means a narrowed esophagus that can trap large pieces of food. It may be because of tumor or scar tissue, often caused by gastroesophageal reflux disease. Achalasia, scleroderma, esophageal spasms are motility disorders that also cause esophageal dysphagia. Achalasia meaning is it's damage the nerves and muscles, make it hard for the esophagus to squeeze food or liquid into the stomach. That is achalasia. Next is scleroderma. It's a development of scar-like tissue resulting in stiffening and hardening of tissue. This can weaken the lower esophageal sphincter. As a result, acid backs up into the esophagus and cause frequent heartburn. This is scleroderma. Next is esophageal spasm. In this condition, caused by high pressure, poorly coordinated contractions of esophagus, usually after swallowing. Esophageal spasm affect the involuntary muscles in the wall of lower esophagus. Here, the obstruction usually more of the problem with solid and liquid, while motility disorders can cause both solid and liquid food dysphagia. The investigation is endoscopy and biopsy. Endoscopy, it allows biopsy and dilatation of strictures. If there is no abnormalities, barium swallow with a video fluoroscopic swallowing assessment can be used to detect major motility disorders. Coming to the complications, dysphagia can make it difficult to take enough food and fluids, and it results malnutrition, weight loss, and dehydration. Food or liquid entering the airway during attempt to swallow can cause aspiration pneumonia as a result of the food introducing bacteria into the lungs. Next, food stuck in the throat can cause choking. So, these are the major complications of dysphagia. We will discuss the remaining topics in coming section. Thank you for watching.